1, 2. 2. 3. 3, 2. Double it up. Time. I'm originally from Shreveport, and I came to Monroe after being incarcerated. So, you know, I'm free now. Monroe is a poor city. It's not a rich city. It's a rural area, but they have some bright spots. When I got here, I saw some of those bright spots, which, you know, I decided to take a part of. You know, I thought it was something that I owed it, the community, based on my behavior that led to me being incarcerated.
You gotta be a reflection of who on the side of you. So
When I started smoking cigarettes, that was the first. I just graduated from smoking cigarettes to smoking weed. It's like a stepping stone to destruction. Thank God I started boxing, because if I wouldn't start boxing, I don't know where that next step would have been. And the road that I travel, I don't want someone else to travel that road. So I just decided to, you know, move forward with my own program, because it also helped draw more kids who have some issues with their emotions, anger issues, self-esteem issues, and the program benefit people like this.
But be conscious of the person on the side of you. That's just like if you at school, you walking. They got all these people walking. Okay, if you walking and you see somebody finna bump into you, don't let them bump into you. But some days you're gonna say, you know what? Let me get out the way. You see what I'm saying?
So the CERT program came at an opportunity where we definitely needed the funding, because we are a new nonprofit. We felt like that would have been a great opportunity for us to partner with a legitimate entity that's really fighting for, you know, education equality in the African American community. But it was also an opportunity where we can link up with an organization to pursue something that benefit the community. The biggest thing that helped us, it was the educational part. Because like I mentioned before, it was a lot of things I didn't know about the vaping. I didn't know about the chemicals that was in vaping. I didn't know how the long-term health issues that vaping. I didn't know about the marketing scheme of some of the tobacco companies. So CERT was very instrumental in giving us that information.
On the ASSERT project, we have built a very strong foundation in our priority communities. So over the past 4 years, we have implemented multiple learning collaboratives where we brought together community-based organizations, stakeholders, rural health clinics, all people who serve our most impacted communities. And we've taught them or built their knowledge and skills around the dangers of tobacco use. We've taught them about systemic inequities and how those social determinants of health impact tobacco use in communities. And then what we've done through our learning collaborative and through technical assistance for all of our clinics and community-based organizations is we have taught them how to address those systemic inequities through either local or systems and organizational policy change.
The training that was provided by the ASSERT team has really been essential for me, and I'm able to use it and sustain what I'm doing as well. So we learn a lot about how to put policy in place where policy is needed. However, there's much more to do, but those are the things that have really been a major point for me in the area of learning. After getting the grant, I was really surprised at some of the statistics that I learned in Louisiana, especially in Tallulah. It's like 30% of the people smoke, which is a high level, much higher than the state and the nation. So yeah, it's kind of a thing that needs to be taken care of quickly.
Practice that we work at now is Southern Family Medicine. We are a rural health center, and our focus here is on those who are underserved medically or those who are uninsured. You know, being in this rural community, you interact usually with a cup of coffee along with a cigarette. And then now what we're seeing, especially in that younger population, is use of vaping, of course. We decided to be a part of the ACERT initiative because we realized that there was a huge gap in access to the needed resources for assistance with tobacco cessation. And they have templates that are already designed and resource information that's already available. So rather than trying to invent a process, they already have processes that have been tried and tested.
Your history, just to confirm, you are not a smoker, correct? Yes, ma'am. And you don't drink, correct? Yes, ma'am.
It is a equity issue. When we talk about equity, we're also talking about, access to health care. Once they're accessing, we're seeing that, maybe there's a cancer that's already there.
We had a lot of crimes. I know crime is kind of connected to tobacco use. And so if I thought if I could get the awareness out as it relates with the tobacco and to tobacco use, that would help reduce the crime. Normally, if I wasn't involved with the CERT program, I'm not that visible in the schools. So being a part of this program, I'm able to go to the schools and talk with the students. I told my husband, I said, if I become a billionaire, I'm gonna buy all of the local corner stores and remove all of those advertisements.
I believe, as so many others, that smoking and vaping is a response to an unidentified emotion that a child has. So when we help them to identify how they feel, then they can better overcome those feelings. I have been paying out of my pocket for years. So when I set up my summer camp last year, one of our partners that we worked with said, man, you need to apply for this grant, and sent me the link and I applied. Well, the Why Try program seeks to address some of the children who are suffering from ACEs, which is adverse childhood experiences in reference to smoking, vaping, and drinking. We had one group, as a matter of fact, we had 127 kids, right? And we were able to talk to all of them about smoking. We did a presentation because smoking is the symptom, vaping is the symptom. It's not the cause. So we want to get down to the cause. And then we want to refer them out for help.
Tobacco use is the leading cause of preventable disability, disease, and death in the U.S., and it's no different in Louisiana. In comparison to white adults, African Americans die more often from a smoking-related disease, such as cancer, heart disease, and stroke, and are less likely to make a successful quit attempt. For every dollar that a state health program spends on helping a person quit smoking, they can see a $1.26 return on investment. That's a public health cost. That's where Project ASSERT comes in. We've been able to help them identify a tobacco control champion, a healthcare professional who is dedicated to addressing tobacco use for the system. We're trying to help any hospital or health center who is interested in developing tobacco control programming. And those things produce dividends in a very short amount of time. You could actually see the improvement in treatment go from about 40% to about 80% over a 6-month period.
Nicotine affects mental health, and the research that's coming out is seeing that there is an association with depression, even schizophrenia, and nicotine use. And that's significant to identify the impact that nicotine has not only on your lungs and your heart and your muscles and your stomach, but it's on your brain and your brain development. One of the things that we have to deal with are the repercussions of historical racism and systemic racism. So what we see is lack of generational wealth and the discrimination in education, employment, things like that. So we don't have a lot of financial resources to help build those up. So ASSERT came in and applied for this grant to help put money into the community to help build capacity so that they can really affect change in their own communities.
So it's really important that you get buy-in from community members, community leaders, and community stakeholders. So again, those are the people who represent the communities that are most impacted. But in order to do that, you can't do that in a silo, you can't do that from an office building, you can't do that from your state capitol. You have to actually go out into the community. Like we're in the Community Book Center right now in New Orleans. But there are places like this all over the state of Louisiana. So there are places like this in Tallulah and Madison Parish. There are places like this in Opelousas and St. Landry Parish that we can leverage. We can connect with community, we can connect with leaders, we can tell them about why this is important, and then hopefully get their buy-in so that we can create power. We can build power within communities so that we have multiple people doing this work. We can't do this work alone. So we know that smoking and tobacco and vape use is a problem for everyone, but we want to prioritize Black and rural communities because those communities have historically been underserved. They've historically been targeted as well. So if we prioritize the needs of Black communities and rural communities, then the policies that we create are going to be community informed, but also they're going to impact in a positive way all of the other surrounding communities as well.
Through this project right here, I had the opportunity to see if I could change a policy. And I didn't think I had the ability to be a changer, you know, a policy maker changer. But with the assistance of a CERT and the information that I received, we was able to do some research on Morehouse Parish school board smoking policy. And we noticed that their smoking policy was almost 20 years over, maybe 30 years outdated. 1987, that was the last time they updated their smoking policy. So I was just at the school board, and I was able to stand up, and I was able to speak up on that policy, and they put that policy on hold.
It's pretty obvious our youth are being targeted by the cigarette companies, right? I don't blame big tobacco. I blame the government. I blame the people who are in Baton Rouge who can make a difference. They could pass laws and put an end to all of this, right? But in my opinion, there's too much money circulating in Baton Rouge. And if we want to rein this problem in, it's got to start right there. How about, let's say, stop the smoking and vaping? They have the ability to do that. I wish they would do their job.
Research shows us that when you have a policy in place that says you cannot smoke in any workplace, including a bar, a casino, or a bingo hall, heart attack rates go down. Our health consequences go down because people aren't exposed to secondhand smoke. And it's also important to understand secondhand smoke is actually more toxic than the smoke that someone who smokes breathes in. And Louisiana's really behind on that. To not have a comprehensive workplace smoke-free policy in our state puts Louisiana as one of those states that you say, do you really care about public health? You know, the easiest thing that folks can do is reach out to the people who make policy decisions. So whether that be an email or a phone call, what I find is people always think somebody else is doing it. So they're not reaching out. And the more people that do that, the more that shifts change. Sometimes it only takes 10 people. And so it's things as simple as that. If they don't hear from community members, they assume you are fine with what's going on.
The next step in this work, after we've built this foundation, we've planted seeds in all of the communities, we want to continue this work. So we see that there are threats around the state of Louisiana to the work that we've already done. So there have been repeals of smoke-free ordinances in certain communities. We see that there are threats to the community by increasing the number of vape shops and cigar bars in communities. We also see that there are policies happening at the state level that could impact the health of young people.
The ultimate goal is to achieve a smoke-free Louisiana. We face a very formidable opponent in the tobacco industry. The dollars that they have to spend marketing their product compared to the dollars that we have to spend to try and improve cessation outcomes, stark contrast. What we need is collective impact. We need that opportunity to have multiple voices, to have more leverage of dollars, to try and make more people aware and knowledgeable of all of the different things that we have available so that we can have a greater impact on the community.
One thing we know is that oftentimes we begin processes, and then when grant funding runs out, then sometimes it can be very difficult to sustain the effort in addition to all of the other clinic expenses that go along with it. So having funding available, having more outreach resources in our communities available, meeting patients where they are. If we can make change on one person, then we've fulfilled our mission. And so that mission just has to continue.
Here in Monroe, West Monroe and Ouachita Parish, they made a landmark decision in that we had 3 communities at once go smoke-free, and that was 10 years ago. So we're 10 years smoke-free here. And the difference that that has made has been tremendous. We want more. We need to see the whole state. There are people out there listening. There are new politicians in office. There are people who care about the community, and they want to know, how can we help and what do you need to make the difference? We can make a difference. It's just about speaking out and speaking out until you're heard.
Creating change is possible. Building power is possible. Amplifying and elevating community voices is possible. We need to put fear in big tobacco. That's what we need to do. We need to put fear in big tobacco that we're tired of this. We don't want you in our communities. We're tired of you impacting the lives of our communities. We're tired of you taking our loved ones. And if big tobacco can see that we are collectively tired and we are mobilizing, we can put fear in big tobacco.
Big tobacco has no interest in little small me, so I'm going to continue to do what I do and try to help my children here and make sure that they grow up without becoming attached to vaping, smoking, marijuana, and those kind of things like that. However, if I have to, I will attack the big tobacco companies as well. Every little bit helps.
We believe that through our continued education that patients are becoming more aware of the need to stop. We believe that if we can continue that forward, that we will continue to be able to be a positive change for the people in the communities that we serve.
This EARTH program, I've been doing it for about 15 months. I must say I've heard some junior high kids after the presentations, and I've heard some to come back to say that they've learned some valuable information that they didn't know that have made them take second guess or to stop, to stop vaping.
So there's activities all over the place, right? So we go out there with those activities. We bring out our posters, our flyers. We talk to kids. Those kids had more questions. It was just amazing. So we're trying to make a difference.
I'm just an extension of the family. When you bring a kid here, I want to make sure that they feel safe here. I want to make sure that if I see some behaviors that's going on that you may not approve of, that I don't approve of, then we're gonna share them together and make it just get it right.
You punch it like you're 82 years old. I'm trying to get you to punch like you're 14.
They're listening. Young minds, they easy to soak up. They soak up. They sponges.
Critique yourself. Who critique themselves in here?
Definitely you can make a difference. Sometimes, you got to step out your comfort zone. Sometimes we feel like if it don't affect our personal space, our personal household, then we don't want to touch it. But sometimes being unspoken could come back and affect us later on down the line. And then it'll make you think, wow, I should have said something then.